Thank you very much, and good morning to the viewers. The Health Promotion Levy is a mechanism actually to incentivize in terms of changing, the consumption of sugar patterns, as well as encouraging the producers of sugar sweetened products to reformulate. In that way, it's part of the health taxes. It doesn't fall in the category of sin taxes, which we see around things to products like tobacco and alcohol. With the health taxes here, it incentivizes producers, it incentivizes consumers, in terms of behavior, in terms of choosing healthier choices. For example, reformulation of less sugar, zero sugar products. It's as a result of the Health Promotion Levy. So how it works is that this is not a tax on sugar. It's a tax on sugar sweetened beverages. So if you buy sugar in the shelf itself, you are not basically not taxed. You don't have added tax that include the Health Promotion Levy or sugary drinks tax. But then the quantity of sugar per gram, that's what is actually a threshold has been put in place, which when it's calculated is actually at 11%. But we know the World Health Organization and health experts actually recommend that the increase should be at 20% to significantly reduce the intake or excessive intake of sugar, which is at the center or directly linked with obesity or overweight, as well as the non-communicable diseases such as diabetes, hypertension, and vascular heart diseases.
And why should this matter for a population like ours? Do we struggle with our sugar intake in comparison to our counterparts elsewhere?
So South Africa, it's one of the top 10, leading sugar consumers in the world. Um, we have the biggest obesity problem, which actually makes us susceptible or to be at bigger risk of developing non-communicable diseases. If you look again in terms of the stats, 51% of death rates, according to Stats SA, it's as a result of the combined non-communicable diseases such as diabetes, such as vascular heart diseases, such as hypertension, and cancer. So which are diet related, and sugar it's at the center. Excessive sugar, excessive intake of salt and fats is at the center of the epidemic of non-communicable diseases in South Africa. So we are sitting with a ticking time bomb, which we need to urgently resolve. And I think what Healthy Living is doing with civil society, it's galvanizing support to put this issue on the national agenda and to respond immediately. So the consequences of not responding to non-communicable diseases today has implication for the health system, has implication for the lives of the people in South Africa.
Right. And of course, I imagine part of the argument is if we're able to get these non-communicable diseases down, we are, as a population, better suited to fight the pandemic, something like COVID-19.
So you are precisely right. So if you look at the scourge of non-communicable disease, the morbidity and mortality, or the implication of non-communicable I beg your pardon, of COVID-19, is directly linked to the comorbidities. And the leading comorbidities, which are linked to diet related diseases, is diabetes, it's hypertension or high blood pressure. We have seen it's obesity as well. So when people have underlying conditions such as diabetes, such as hypertension, they are more at risk of getting severe COVID-19 symptoms and actually, unfortunately, also death. So the fighting chances of the immune system defending or fighting against the COVID-19 virus for people with non-communicable diseases such as diabetes. So we've seen stats, even the Minister of Health indicating in the media that people with obesity, people with diabetes, people with hypertension are developing severe effects of COVID-19, and actually it results in many of them in mortality. So we've been sitting with the epidemic, with a silent epidemic, which we have not been adequately addressing. And actually the COVID-19 has actually amplified the pervasive nature of sitting with non-communicable disease, and a slow policy response, a slow public response, a slow political response in addressing this epidemic.
Yeah.
As much as many people are still dying from non-communicable diseases now, but with COVID-19, we're seeing the numbers are skyrocket, which is a big problem for South Africa now. So we have an opportunity now as the country during COVID and post-COVID to be able to address, and that's why Healthy Living Alliance is calling for a stronger health promotion levy or sugar drinks tax. In order, we have seen, I can give you an example, even with tobacco. 4 out of 10 people were smoking before the implementation of regulation on tobacco,
Yeah.
including also public education. But we know that today 2 out of 10 people are smoking. So we know policy regulation works.
Right, and that's where I was going to go, right? Very quickly, people often speak about the price elasticity of certain products. Some, products, no matter how expensive they are, people will still buy them because they need them or whatever the reason may be. What do we know about the price elasticity of these type of products, and whether or not increased tax does work as a disincentive?
That's a great question, actually. Two things I want to put out. So when you implement a policy and a regulation, it's important that the regulation is actually monitored. So if we look in the mainstream, we don't know for sure for sugary drinks that are coming in the market, so such as energy drinks, such as your cheap sweetened beverages like your Twizzler and all those, if they are in the mainstream also regulated as your Coke, for example. So I think there is a need in one part to actually have a monitoring mechanism so that all the products that are in the market are not missed. Then communities can access them easily in cheaper prices, in a way that actually it defeats the purpose in terms of achieving the goal of reducing the overconsumption of sugar and obesity or overweight in the country. Number two, the issue again of addressing the illicit of products ensures that we can have from trade and industry, it needs an intergovernmental, interministerial kind of coordination and the response, because what is absolutely critical is that when you have policy in place that monitoring, there are no products that flood the markets that, goes through and they are not monitored and they don't actually go through the same kind of regulation that other products would.
Right.
So I think that's one of the things that I think as Healthy Living Alliance, we want government to monitor to ensure that there is actually compliance.
Lawrence Mbalati, thanks very much for your time. Certainly appreciate your being able to shine a spotlight on this issue. Lawrence is part of the Healthy Living Alliance. In fact, he's a programs manager there. Lawrence, once again, thanks very much indeed.